you all on 223 third episode of Gyan Pravah, a unique initiative by Fogsi. I am Dr. Sejal Nayak, Chairperson of Endoscopy Committee Fogsi. Welcome you all. Today we celebrate not just a leader but a phenomenon, a woman who lives every moment with passion, turns into milestones and dreams into reality. She is the heartbeat of Foxy, the spirit of progress. Dr. Sunita Tandulwadkar. Welcome you, madam. And thank
Sejal,
you
I
so
never
much.
knew that I'm a heartbeat of Foxy. So sweet of you, yeah. So sweet to use such words.
So, madam, we are so grateful to have this opportunity under your visionary leadership. In just few months of her presidency, she has gifted us a legacy that will live for decades. Sampurna, Know Your Numbers, Do Tike Zindagi Ke, Anubandh, Eagle, Mukta, and the jewel them of them all is the Gyan Pravah, a living library of nearly more than 200 episodes now, inspiring us each day. She has shown us the women's health is not just medicine, it's a nation building. Her mantra says it's all. Swasth Nari Samruddha Vatan Har Ghar Foxy hai. She is pioneer, a mentor, a visionary, and all of above, a soul full of life. She doesn't just lead Foxy, she makes it soar. She doesn't just heal women, she empowers generations. And if words would capture her spirit, perhaps this says it's best. जुनून जिसमें जज्बात जिसमें है जुनून जिसमें जज्बात जिसमें हर पल एक नई बात जिसमें फॉक्सी की पहचान बन गई सुनीता मैडम एक मिसाल बन गई. She is the force who proves every single day that when passion meets purpose, nothing is impossible. With immense pride, respect, and joy, let us welcome our President Foxy, our guide, our mentor, our inspiration, Dr. Sunita Tandulwadkar.
Sejal, I'm so touched. You know what I should do, Dr. Vikram, is if I'm having any low phase, which is very rare, but anytime I'm feeling low, I should just give a call to Dr. Sejal. Dr. Sejal, how are you? She will speak so good about me that my mood will get elevated automatically. I don't know whether I deserve all these sentences, but thank you so much, Sejal. You have so much pain it down with so much of a love. I can feel and I can palpate that. And you all know that you all are my heartbeats. I'm
Truly deserve
so
it, ma'am. Truly deserve it.
no, but I'm really touched with this. Dr. Vikram having 220 episodes when we have started in Jan, when our episode number 9, 10, we used to think when we will cross 50, when we'll cross 100, and how it will go. And I'm so amazed with I'm nearly thankful to even Evangel Tree who works so beautifully and they're always there 15 minutes before 8 o'clock so that everything goes flawless. I'm thankful to all my chairpersons. They are all trying to get best of the faculty, best of the dialogue. And Sejal, I don't know whether she's working because I'm president. The way she's working, all chairpersons are getting heart attacks because her eagle, we have crossed podcast more than 200, but she has crossed single-handedly eagle more than 100. We are celebrating and we are celebrating every now and then. Sejal comes out. Today is this celebration. Today is this milestone. Sejal, you are not aware, yaar. You are a gem of a person. You are so sincere, so hardworking, and very skilled surgeon. You are loved and you love everyone. So always, whenever I see you, beta, I just feel God protect this girl. She's an angel. Sejal, today you got Dr. Vikram. You are going to have a discussion on Urogyne, which is so much of a need. And I'm so thankful to you. And I'm sure this will bring out best of the academics. You know, Dr. Vikram, I could, because of this podcast, I could have so many people, faculty, to come and involve them in my Foxy presidential year. And I'm thankful to each and everyone. Of course, we do have a non-academic, spiritual, philosophical, social backgrounds also. And there is so much to learn from those people as well. But I'm thankful that these all my chairperson are giving me an opportunity to connect the great academicians across the country, getting them on a Foxy platform. Thank you. Thank you, Sejal. And welcome, Vikram.
Thank you so much. 23/2 is my birthday, so 2/23 is quite a coincidence for me also. Thank you so much for having me.
So you are Aquarian.
5 pieces, man. Pieces.
5 pieces. Okay.
Thank you so much, ma'am. And would like to introduce our today's guest. Today, we step into the subject that is fascinating as it is misunderstood: cosmetic, aesthetic, regenerative, and the functional gynecology. And to guide us through this world, we have with us not just an expert but a true pioneer, Dr. Vikram Dukle. Dr. Dukle's journey is one of his curiosity, courage, and conviction. From his medical beginning at D.Y. Patil Medical College, Goa, to training the world's leader endoscopy, infertility, robotics, and cosmetic gynecology. He has always chased excellence and never settling any ordinary. But what makes him truly special is that he didn't just practice medicine, he created new paths. He founded Anamiva Clinic, Goa's first only dedicated center for cosmetic gynecology and endometriosis. He introduced cutting-edge technology like 3D laparoscopy system in Goa and Western Maharashtra, and through this Pinnacle Training Academy, he has already trained more than 500 gynecologists, ensuring that this knowledge flows far and wide. He is not just a doctor but also a writer and thinker. The author of 3 books. Through them, he has dared to open conversation on topics often considered taboo, reminding us that women's intimate health is about dignity, empowerment, and wholeness. His passion goes beyond hospital and classroom. He is also a mentor, and I must say with the pride, he is guiding me as well to shape my own journey into this same field. Today, as we explore this inside-out cosmetic gynecology uncovered, we are in conversation with a man who blends science with sensitivity, technology with compassion, and innovation with fearless commitment to women's wellness. Welcome you, sir, and thank you so much for being our guest today.
Thank you.
Thank you so much for having me. And I'm really excited about this conversation about cosmetic, regenerative, and functional gynecology. It's not just my passion, but I feel that with this podcast, it's time the world hears the inside out story of why it matters so much. So really thank you, Sunita ma'am and Dr. Sejal ma'am, for having me in this Gyan Pravah series. Hope to have a wonderful conversation ahead.
Thank you. And I'll join the viewers link to listen to both of you. Thank you.
Thank you. Thank you, ma'am. Thank you so much. So, Dr. Vikram Dukle, welcome once again. And I would like to begin this conversation. Could you share your journey? What drew you into this cosmetic, aesthetic, regenerative, and functional gynecology?
So when I began my career as a gynecologist, my world revolved around the usual fertility, delivery, childbirth, complex laparoscopies eventually, then endometriosis, 3D laparoscopy, robotics. But over the years, I kept noticing something, that the women who didn't have a disease, but they carried invisible scars, scars of childbirth, scars of surgeries, scars of silence. And these women weren't sick, but they weren't whole either. They were living half lives, quietly sacrificing intimacy, confidence, and joy. And I feel that that realization hit me very hard. Medicine isn't about just survival. It had to be about living fully. And that's what drew me into cosmetic and regenerative gynecology. It is involving the principles of plastic surgery, dermatology, and many other fields into gynecology. And that is what a space, I think I could blend science with empathy, restore not only tissues, but dignity, and help women rewrite their stories. So that has been my journey. The journey is very simple. I didn't choose this field. The woman I treated pulled me into it. And that is why I feel that this is a game changer in the next few months and years to come.
Amazing to know the insight and the empathy and the like thought of patients. They are coming with lots of other complaint, which usually, if we don't know the treatment, we usually ignore them.
Yes,
You know.
definitely. We tend to send them to maybe another specialty, and ultimately it becomes that the patient doesn't trust you that much because you're not able to give that exact service what she's really coming to you for.
So many, like including myself, also was thinking like cosmetic gynecology is luxury or only about the its external appearance, or how do you see it differently, especially in terms of restoring confidence, intimacy, and the quality of life for a woman?
Yes. So I'll just put it in a very easy way. So imagine that we break our front tooth in an accident. So fixing isn't about luxury. It is about vanity. It is about smiling again without shame. It is about eating without discomfort. So cosmetic gynecology is exactly that, except the tooth is far more intimate and the impact is far more deeper. So a woman who can't enjoy intimacy or who feels embarrassed with a partner carries the pain silently into her work, her relationships, and even in motherhood. And when we restore their anatomy, her comfort, her function, we are giving back her freedom. So I feel that it's not luxury, it is liberation. It is giving women their wings back. And that is what you're also giving wings back through various programs. So this is some part of what we do. And hopefully you'll be able to do it soon now.
Yeah, I'm looking forward to it greatly. So, in your practice, have there been a patient experiences or stories that deeply moved you? Like any true example showing this true impact of cosmetic and regenerative gynecology, how it can change the life.
Yeah, I feel that if a service is not being able to reach the lowest strata of our population, and the technology what we use, if it doesn't reach, then I feel that it is not worth it. So I'll just give you, I have unimaginable examples, but I'll give you this patient who came to me. She said that, doctor, I don't feel like myself anymore. I feel that the body doesn't feel mine. She wasn't depressed, she wasn't sick, but she has lost her confidence. She had lost her intimacy. She had lost a spark. So we worked with her a combination of regenerative treatments, therapy, a lot of lasers. We have the pelvic rehabilitation with the high intensity electromagnetic chairs. And a few months later, maybe around 4 months post her treatment, she returned and basically she almost lied on the floor and said that you didn't heal me, you saved my marriage, you gave me confidence, you gave me back my smile. So I feel that that day had made my career worth it, and I understood something, that cosmetic gynecology or aesthetic or regenerative, it's just not just about procedures, it's about stories, as you exactly asked me. Stories of women reclaiming their joy, stories of relationships reborn, and stories of silence turning into laughter. And as we as gynecologists, if we can do, I think we are the most deserved branch to do this. So I think that we have to have many stories like this. And believe me that this is one story. We have trainees all over India, and everyone keeps on messaging us that this vaginismus patient has conceived. So it is not that only I am, it's through our hands that everywhere in the country we are having so many stories. So definitely it is reaching far and wide.
Wow, so amazed to listen, and this may be the gratefulness they show to us while coming back with the feedback, and that is the actual petrol or the fuel to move on further, that we are doing the good work and we should keep on doing it,
Absolutely.
continue doing it. Amazing. Sir, regenerative gynecology is often, it is called as a future, right? As you said. So why do you believe this is the next big revolution in women's intimate health?
So if you must have been seeing now that every conference has a small part of regenerative medicines also. Someone is talking about PRP, stem cells, exosomes. So because regenerative gynecology, I feel, is absolute future. It is not about repairing. It is also about awakening. We are using platelet-rich plasmas. We are using growth factors. We are using stem cell therapies, lasers, many energy-based devices, because these stimulate the body's own healing. It is like reminding the tissues of their youth that, okay, now you have to reignite the vitality that was always there. And I feel that this is not a revolution, because we are just shifting from disease management to life enhancement. So these words, I feel, is regenerative medicine. And believe me, the results with regenerative are far, far, far better. And orthopedics, dermatology has already used this for a long time. And we as gynecologists definitely can start with this.
So world is changing definitely from therapeutic to preventive medicine more. So this would be really be like
Yes.
now the life expectancy has also been increased, and the more of elderly people there, and the more of they are healthy and would like to keep on moving around, and would like to have all their organs and their functions definitely working well till their end of their life. So
Definitely.
yes,
That is absolutely true.
definitely there is a future, and there is going to be a big revolution in this field of gynecological, regenerative and restoring medicines. So, but there is still stigma and hesitation in openly discussing these intimate health issues and even the stress urinary incontinence. They do not come themselves with the leading questions. Okay, do you have any treatment for this, my urine leak or so? So, how do you break those barriers with your patients, and how do you encourage the society at a large scale to see this as a part of the is a holistic health or the holistic approach
Yes.
for their health?
So the biggest challenge we face is not medical, as you say. It is cultural. It is stigma. It is silence, and the unspoken rules that say intimate health is shameful to discuss. So at least, how do I break that in my OPD? I make it absolutely normal. I use everyday language, no big jargon. I just tell patients this is like dental care. If you can talk about cavities, you have to talk about intimacy also. And for the society, we need platforms, we need talks, we need books, we need podcasts like this one, because the more we speak, the more we are going to normalize it. And as you rightly said, people with, I have had patients who have been suffering for 20 years, 30 years. My eldest patient is 94, 95 years. And for the last 20, 30 years, she was wearing diapers. So with few treatments, she's off diapers, even at 95 years of age. So this is absolute. It is not a luxury. It is just as basic as mental health, nutrition, fitness. And I feel that until the society embraces that, the woman will continue to suffer in silence. And that's why we are here to change. I feel that we are in the right position to change that. And if I could, if I could say easily that this is the right time, because we are at the right place at the right time. People have stories started to accept, and the more we talk about it, definitely I feel that we can reach far and wide.
So, in your journey, what has been the most challenging moment that in this cosmetic gynecological field, and how did you overcome it?
So I feel the most challenging experience is skepticism. Okay, when I started, even my family, even fellow doctors questioned me, why this? Is it really necessary? You are already doing very good laparoscopy work. Why this? Patients also hesitated. Society started judging. But I kept going because this, I've seen the transformation in my patients, in women's lives. The data that we have now is enough that we can say that the results have really spoken themselves louder than the criticism. And today, with those very skeptics refer those patients to me. So it is that it is something that the lesson is that if you believe in your vision, keep walking. The world will eventually walk with you.
So, was it a difference in being a male as a female intimate caregiver compared to being a female as a, is there any patient's
No, absolutely no.
selection
It is
choice?
just how the way we perceive, because we have many of our trainees as male gynecologists also. But you will agree not to disagree that I feel that everyone can speak open and wide about it, because we are anyway doing everything which has to be about intimacy. So why not enhance? Why not give them really rightfully what's theirs?
So, you have also, sorry if I have interviewed, but
No,
you
no.
have pioneered, dedicated, one center for this Anamiva and the Pinnacle Academy, where you have trained more than 500 doctors so far.
Yeah.
So, what do you feel is the most important when guiding young doctors who are entering into this field? So, what is any quality they should have, or any mindset they should have, or what would be the most important your guiding point for them?
So it is not about only the young doctors now. I feel that each and every gynecologist has to embrace this. And I always tell them at our center that it is not the laser machine, the scalpel, the technique. That is all the easy part where you can have skills. The hard part is empathy. Hard part is listening without judgment, respecting the silence between words. And because when a woman comes to you with an intimate concern, she's not only asking you for treatment, she's placing her deepest trust in your hands. So the most important thing, and I feel lesson for gynecologists, is learn the art of listening, learn the humility of serving well. Because cosmetic gynecology is not just a branch, it is an absolute responsibility. So I feel that that is really what I do at our center. And that is why we have the maximum number of people who have actually gone back and started immediately.
So that fire, or that, you ignite this spark into your training, that would definitely change the view, the way they examine or they talk to their patients, the way they treat. Definitely, after coming back from you, I have started giving much more concern about their future pelvic health, even my obstetric patients, delivering patients, and everyone. So thank you. Thank you for. So if you
Absolute
could
pleasure.
change one myth or misconception about cosmetic gynecology, what would it be and why?
I feel that cosmetic gynecology is not only for the rich, it's not only for vanity. I feel that it is for every strata of population, every right, because as of now I can proudly say that we have celebrities as patients, we have our own colleagues as patients, we have laborers as patients. So it is right from the lower strata to the highest strata who are coming to us with the same concerns, because the concerns are same. And the myth that only the rich can afford, that is what we wanted to break. And I think that now it is loud and clear that it is for everyone. Because right from where I was with Dr. Rahul sir, the patients in entire Maharashtra, the interiors of Maharashtra, they are absolutely happy because believe me that hysterectomies are avoided. Recurrent discharges, which are so troublesome for the patient, they are avoided. Stress urine incontinence, which is a very, very common complaint. So right from the interior parts till the metros, we have everywhere. I think that the myth is basically that it is for everyone.
No, wow. So it's not only it's being a female that should be their birthing right to have the healthy.
Everyone should be able to access it.
Of course. So as you said about the accessibility, acceptancy, and the impact on the females, like their lives. So where do you see this future as a cosmetic and regenerative functional gynecology in India?
So in the next, because any category creation takes 10 years. 10 years back, we were saying laparoscopy not to be done. Why? Now it is absolutely laparoscopy. 10 years back, there were no robots. Now, recently, I concluded my training in advanced robotics. It is such ease with which you can operate. So in the next I won't say 10 years, but next 3 to 5 years, cosmetic is going to be the absolute mainstream. And if you don't adapt to it, then it is just like artificial intelligence. If you don't adapt to it, it is going to be there, but you won't know what to do. So the earlier you start getting into this field, you will be able to understand what technology you can use, and at your own center, how you can give results for the patients, because ultimately it's about giving result to the patient. So that is
it's a very deep science, and if this science or this knowledge is incorporated in a very early in the life of the gynecologist during their initial years, during their postgraduate training, so this would not be the this would be a in-house everyday service that we provide, like ANC care or the post-delivery care. It should be incorporated as our routine patient care.
Yeah, absolutely. Recently, 2 weeks back, I was invited to my alma mater, D.Y. Patil Medical College in Kolhapur, where I spoke to all the residents and the consultants. So they said that this is the right time where they can think of seeing the patient well, listening to the patient in a different way, understanding anatomy in a different way. So I feel that the postgraduates, as you rightly said, is the right time where this branch has to be started, because that will give them an added access leverage over the rest, because they will be able to connect, counsel better, and talk to the patients better. So definitely,
And the expenses or the investment what we have like 5 years ago or at that time before COVID time, where which was like haywire. While now, can you suggest some like a low investment plan where the future doctors or those who are inclined towards starting, they at least some quality care to their patients?
so the best investment is investment in yourself. So enhance the skills, I feel, because your surgical skills will be your surgical skills. No robot, no technology can change that. And even today, I at least have half an hour on the pelvic trainer, or we. So it is something that you have to enhance every day. So surgical skills will be definitely there. And technology, there are so many available right now. So depending on what set of patients you have, what would be the, how deeper you can connect to the patients, that is how you can decide. But to start with, the easiest is to start with regenerative medicine. That is PRP, wherein even right now, there are wound gapes, there is difficult healing, there are keloids. So which with PRP, you can definitely start right now. So there is no investment needed as such. And believe me that even doing only that also you will have a lot of patients who are really happy. So it may not be that 100 out of 100, but at least if you're able to help even that one, because even in IVF, it is not 100 out of 100. So there is, but here, if you are able to have that one, help that one patient, I feel that it is really life for her.
So you do infertility, you do cosmetic, you do laparoscopy, endometriosis, robotic. So what is your like, the first only prefer branch out of all?
No, now I have recently I have stopped obstetrics 8 months ago. So it is only cosmetic and robotics and 3D laparoscopy now, advanced laparoscopy. So I feel that it
Pick
is
one.
definitely, yeah.
Pick
Pick one.
one.
I would definitely feel pick cosmetic gynecology now, because it is now my passion, and I want people to let it reach far and wide, because people should adapt to it as early as possible.
And if not a cosmetic gynecologist, what would you be? If not a gynecologist at all, then
So I have many other hobbies. I do a lot of reading. I Now I am into artificial intelligence completely. So there is something called as an AI generalist, wherein we help people. Uh, we have conducted courses now we had this batch. We have people from the entire country coming just to learn about AI for healthcare. And I write books. I was a state player for table tennis also. So there is a lot of passion with sports.
so
I play with
where
the kids.
from where do you get so much of time, sir, to do
AI
all this?
AI helps you. AI helps you. So start with AI. Artificial intelligence reduces your entire workflows, your OPD, your talks, your podcast, your presentations. So I feel that everyone should adapt, and that would be also a message along with cosmetic gynecology. Adapt AI also.
So I guess I am talking to the real Dr. Vikram
Yeah, yeah.
Dugle, not the
This is not.
virtual one.
No, no, this is not my avatar. This is myself. Hopefully, I should have one soon.
Yeah. Thank you so much. It was very lively and very like igniteful, thoughtful discussion today with you. And we are really very having a pleasure to have you here today.
Thank
And
you.
I am personally very grateful to accept my invitation as a guest today. And thank you so much. Thank you for being here.
Thank you so much. Cosmetic gynecology isn't about vanity. I feel it's about voice, and it's about women finding their confidence, their intimacy, and their dignity again. So this branch is exploding, as we also know. And if this conversation of you and me and Dr. Sunita ma'am encourages even one woman to step out of silence and seek help, or maybe even one gynecologist to see this field with fresh eyes, then I believe that we have taken a step in this right direction. So absolute gratitude for inviting me and having me and letting me share my journey, because I think this is the first podcast I have ever done in my life. So really grateful that you have invited. Rest of the podcast I was doing by myself on intimacy and intimate issues. But this is something I think that we can make a larger impact with each and everyone
Great.
knowing about this branch.
So it is Dr. Sunita Tandulwadkar's brainchild, and Madam has this everyday podcast at 8 p.m. And thank you so much, sir. And we are really obliged. And as you said, small single step, one step at a time may change the world. one day. So thank you, madam, once again for giving us this opportunity. Thank you, Eventual team, for your technical support. Thank you, sir. Good night.
Thank you. Thank you, everyone. Thank you so much.
Good night.